I'll start.
Go for it.
Okay. So I'm Dr. Lindsay Bira. I'm a clinical health psychologist, and I've worked with ketamine for about 6 years now in my private practice. And currently, I refer patients to IV ketamine, IM ketamine, and then I also use the oral lozenges integrated into my practice. And I have seen many benefits of ketamine for more severe cases, receiving a higher dose through IV, and even not so severe cases who, want a kind of reset in mood or the ability to process something or just wanting to be more creative and carrying less stress. There's a range of why my clients have chosen to seek ketamine assisted therapy. And my job as a psychologist through that process is to help them prepare for it. So this is where we get into the set and the setting. So the mindset and making sure they're facilitating the right setting for them. And we create intentions around that. They get the tools, they start practicing the tools before they go into the experience. So that's part of my role. And then we kind of create a plan of what they want to work on. And then sometimes I am sitting with them during their ketamine experience. So, especially for my clients who are working with more severe trauma and want somebody to hold space in that way. I know Dr. Silverstone, you also will sit and hold space and help facilitate that process. I've found being able to sit with my clients through ketamine to be very useful, even at the very low doses, because it serves as almost an opener and it allows them to experience their own trauma or stressful memory with a little bit of a different perspective. So they're less emotionally flooded by it, and we're actually able to talk about it and move them through it in a way that gives them not just a new perspective during the ketamine, but also after. And I've seen some, really profound shifts in terms of my clients who are processing trauma. And then, also be able to just sit with somebody and just flow with what comes up for them. And we know that we don't want to be too directive in these kinds of situations. So part of holding space is allowing the client to lead and the client to do that work. My other job after a ketamine experience is to help them process what came up afterwards. So we call this integration. So integrating what they realized, what was presented to them, connections that they made into their real life, because it's not about the ketamine experience totally. It's about how we use what was shown to us or what we get from that in a way that we elevate how we're moving through our life or putting actions in or making sure we're taking those cognitive shifts and maintaining them over time in beneficial ways.
Yeah, so I couldn't help but smile and nod at everything that was being said because it's such an important component of ketamine. I'm Dr. Silverstone, founder and medical director at Rewired Ketamine. I am the facility that gives people the opportunity to have ketamine either IV or IM. Um, it's actually quite fascinating to see how ketamine allows people to materialize some of their trauma and to kind of bring things from the recess out to the surface. But I'm very, very clear. What we do at our ketamine center is try to deliver the experience as best as possible. We use everything that's available to us in evidence-based medicine to facilitate and create the space for ketamine. But we are clear we are not mental health care providers, and nor do we pretend that we are. We do guided sessions only in the purpose of allowing things to become illuminated and surface. We really rely heavily on the community at large, and we do a lot of referrals to Dr. Vera for that purpose, in order to be able to be given the tools and the guidance for both integration and pre-ketamine treatment awareness. So I used to sit with patients and try to explain what the experience was going to be like. And I'm finding more and more that that's kind of futile because unless you've experienced ketamine, it's rather difficult to put it into contextual words. So my job is only to ensure two things: that the patient feels safe and that the patient is actually safe during the delivery of the treatment. And without integrative care and talk therapy, while ketamine has profound effects, it just doesn't reach its maximum potential. We do know that the moment that you pair the two together, we have incredibly high levels of success. And when I say high levels of success, I'm talking about anywhere from 85 to 90% breakthrough from, chronic depression and anxiety. So it's really quite important that we pair ketamine with some integrative care. And quite honestly, if you can get a little ahead of the game and get some coaching prior to, you're just going to make the experience even better.
I definitely agree. And that's what we're seeing in the research too, is how important the preparation and the integration is this. It's like the ketamine is a huge catalyst for change. It's really what I look at it in terms of the power of it. But I think people really need to understand that you need to be prepared for it and then to really use what comes up to weave through your life. That's even more powerful.
And by prepared for it, I think I just want to add, in terms of context, it's not knowing or feeling what the experience is going to be like. It's intentions and efforts while the experience is happening. And that's really something that comes out of a toolbox from a good provider, a mental health care provider. It's definitively true that once these types of traumas are exposed, if you don't have the actual tools for it, it's not that it's necessarily a waste, but it certainly doesn't go as far as it should. I always give the analogy, and I understand it's somewhat derogatory to compare it to steroids, but the analogy for me is very simple. You can't take steroids and feel the chemical effects. You're going to get that kind of excitability and a little bit of that roid rage. But if you don't actually go to the gym and start lifting the weights, you're not going to get that full benefit of the muscle build that is what we're looking for. So again, it's a bit of a derogatory comparison, but it does make sense where when you use the ketamine, there is the effect while you're in the room receiving the ketamine, and those effects are profound and they're chemical. But those effects last for about 3 to 5 days post ketamine therapy. And that's really when you're able to do a lot of that work to get that neuroplasticity. And those changes are absolutely permanent. So if you really want to bulk up, so to speak, it's to me imperative that we continue the work outside of the treatment room and with some level of talk therapy in order to really just get to that 90% success rate that we're seeing in data.
Yeah, I actually like that steroid example because it paints the picture really well. And it also reminds me of whenever we're learning any new type of skill, this is also very true in sports. Things feel clunky until you get the technique, and then that technique opens you up to a whole nother level of performance. And so I think about that with ketamine too. And a lot of things that we're doing for our own self-growth is if you don't have the right tools and the right roadmap, then things can kind of fall flat or just not be as helpful as they could. I think ketamine on its own is helpful, and we've seen that, people benefit, especially when they're having more severe symptomatology. But when we have the technique and then you say, oh, this is how I navigate this, now it kind of opens up a whole nother level.
Right. And borrowing off of that, just to add a little bit more, ketamine really is a cheat. It makes that process easier. And it makes that process easier just because of the function of how ketamine works in the prefrontal cortex. So we're really presenting an opportunity for a lot of people who have been struggling both with the processing component and the ability to apply those tools, and giving the greater population an opportunity to really succeed. And quite honestly, that's what I'm seeing in my clinical settings.
So I love that you bring up the prefrontal cortex, Dr. Silverstone, because when I think about what my job is as a psychologist, I often say that I'm a prefrontal cortex trainer. So whether I'm meeting with somebody one-on-one in therapy, doing evidence-based treatment, or if I'm doing my resiliency work, so resiliency training that I do in other contexts for business leaders, it's always about the frontal lobe. So we are exercising the frontal lobe. What allows us to do these bench presses for the frontal lobe? Ketamine, again, going back to the catalyst, and you just mentioned how ketamine has a big impact in the frontal lobe. Will you explain more of that, kind of the mechanisms behind that?
So the funny part about it is, no, not really that well. And the reason is if you look at every single article that gets published, there's probably close to about 100 articles in the past 20 years, double-blind, placebo-controlled, peer-reviewed, published in reputable journals, that'll tell you this is a fact. Ketamine works, and these are the numbers, and this is the recommended protocol. And then if you read all the way at the end of most articles, they say, however, the true mechanism is not well understood and more research is necessary, right? So we do know that with brain mapping that there is activity in the prefrontal cortex and the hippocampus, the memory center, but the exact mechanisms is still not really well understood. But again, with brain mapping, we do know that these are the targeted areas in the brain that do get lit up. And I oftentimes kind of reference it back to very similar mapping as you would see with juveniles, early adulthood, and the young adult years when you're really more capable of learning and the neuroplasticity environment is much richer. So we're almost that expression of having our cake and eating it as well. It's like if you're older and you have all that knowledge and they say youth is wasted on the young, we actually are testing that theory and saying no, we can actually duplicate some of that same level activity where with all of your information, all of the knowledge and all of your experience in the past x amount of years, you now have the malleability and the dexterity and the neuroplasticity to be able to make permanent changes similarly to when you were influenced in the younger years. So I couldn't tell you the exact mechanism. I know that there's a lot of ongoing theories, but we do know that that is a primary source or mapping of where we see a lot of the function.
Yeah, it's just fascinating. And when I've had some of my own one-on-one clients in my private practice go through the ketamine process, I always think about this kind of dual process happening. So one, it's the ketamine in the brain having an effect on these different parts of the brain. So whether it's the limbic system and kind of stress and fear part of the brain, and then how that's functioning with the frontal lobe, we don't really exactly know, but it's helping the frontal lobe function better in some kind of way. The secondary process is the skills that they have to use to make the process even more efficient are already frontal lobe skills. So it's almost like a double whammy. So this process of surrendering and trusting and attaching to intentions and having a plan, and staying calm, that's kind of like the trust part of the process. So they're still using the frontal lobe skills while they're going under ketamine, which I think just kind of reinforces a lot of the process. And when, I've seen people have a little bit of a, not as effective experience, it's because they just didn't prepare for it. So they kind of just, threw themselves in and maybe went to a clinic that didn't have the professionals who were really focused on the preparation, which I know that's very important to you. And that's why I've felt so great aligning with you and Rewired Ketamine and doing cross referrals because I just love the way that you approach it. And you are a physician within it, but you also know how important it is to spend time with patients. And for me as a psychologist, that's what I do is spend time with patients, right? And so for me, meeting you and seeing that your heart as a physician was really in the right place with it and you really give that has just made me feel so great about you and Rewired Ketamine. And, you know, I I see how important that preparation process has been for my clients. And I'd say now when people ask me about ketamine is, there's been a few clients that I've had that were very long-term clients. And a couple of these were clients with OCD, which we don't have a ton of research with ketamine and OCD. And sometimes it can be a lot more difficult because with OCD, there's a lot more rigidity, like that anxiety is hanging on a lot tighter. So when they get into an experience like ketamine, they're feeling that letting go, it can be scary because their normal systems that are keeping them safe but are actually reinforcing the disorder, they aren't working. And so these clients, of course, benefit from preparation, but a couple of my long-term clients with that OCD type anxiety, once they did ketamine, they said, "Oh, I'm good." I said, "Hey, you haven't shown up on the schedule. What's going on? Haven't heard from you in a couple of weeks. Do you want to schedule?" They say, "Actually, I'm good. So I'll reach out when I want to." And then I don't hear from them for 6 months. And then, of course, they'll pop up on my calendar and I get to process this with them. And they'll say, "Yeah, it's amazing how it shifted things. I felt free from my thoughts. Life just was more joyful." And, to me, I got worried about them because they were a consistent client. But to hear that, I mean, that's my job. I don't want somebody to stick around with me forever. I will as I'm facilitating their growth. But if ketamine is something that allows them to be liberated more into their life without those symptoms, I mean, I just round of applause for that. That's what I actually want.
So there's a couple of things. One patient mentioned something in a review, and it really struck a chord with me in the best ways possible. And she said, for the first time in her life, her brain was working for her and not against her. And I felt that that was such a validating statement in exactly what we're trying to do. That I keep using that line over and over again. And in fact, especially with like the OCD type patients, where their brains have been so effective at restricting their ability to function, all of a sudden their brains are starting to be their allies. They feel, like you said, liberated, they feel free. And then the second thing that I often hear is connected. I feel connected. And while they may not mention it so astutely during, our screening sessions, almost everybody that comes here has some level of a feeling of disconnect. And post ketamine, they really do get this level of connection, and it's new to them, and they're not exactly quite sure what to do with it. And one of the reasons that I theorize is why we're getting that type of a response is because we're actually encouraging patients to experience emotions. We're not telling anybody to hide away from emotions. It may be an uncomfortable emotion, but we allow patients to experience that. If somebody's going through some level of discomfort because they're coming through some trauma during their ketamine session, we're not the type of clinic that's just going to throw benzodiazepines and to numb them out from it. We're actually going to encourage them to experience it, to feel it. And it's that personal connection where we sit next to them and tell them, you are safe. Don't worry about it. You are safe. That allows them to go through. And then that's what we call ketamine breakthroughs. Once they come through to the other side, they'll feel some level of almost rebirth because they're now connected to their emotions. But once they have that connection, we always encourage them to go ahead and say, okay, now that you have these types of expressions, you're not afraid of these emotions, you're feeling reconnected, please go seek somebody to help you through because you're going to need the tools into how to navigate this. And that's kind of where we're seeing so much growth because they're prepared, they're connected, their brains are working for them, and then they're open to applying those tools, and then we're cheating because the brain is open to learning those tools, and then we have success. And it's really exciting to be in this type of a cross section where I'm able to work with mental health care providers like yourself that have been likely stigmatized for working with psychedelics, um, amongst peers, and especially in the allopath world. So it's really exciting, like really genuinely exciting.
I feel the same. And, I have a couple things to say about that because the psychedelic, some people say the psychedelic renaissance, what's happening with psychedelics is quite fascinating, profound, exciting, and scary. And ketamine right now is the only psychedelic, and it's considered a dissociative, but it has some psychedelic properties. It's the only psychedelic that's approved and that's being used legally. At the same time, there's a very large underground market that's happening for other psychedelics. And one reason why this is the underground world never went away. So, psychedelics got banned in the 60s and 70s, but actually a lot of it just went underground. So it never went away. But number two, people are really seeing the good research coming out now about MDMA, mushrooms, some other substances. It's trendy now to go on these psychedelic experiences. And while they can be actually very helpful, it's not regulated, and we're seeing a lot of negative effects coming from it too. And so I always tell my clients that number one, they need to be working with somebody. And then number two, why not try ketamine, especially as a first step process and create a relationship with ketamine because it's very safe. It has overview, it's being regulated. There's somebody who cares about the process, who's doing it legally. And so this is something that I'm very passionate about as a psychologist because we're seeing negative effects of psychedelics and people having more pathology, more symptoms than they had before their experience in the underground world. And I don't want to scare anybody around that, but I do want to have some healthy trepidation, is what I've been saying, and some, very like strong guidance to what's already being offered in a safe way, which is ketamine. The second thing I wanted to say about that is that in order to be a ketamine assisted provider, you really, and there's no legal law around this, but you should have the experience of ketamine yourself. And one thing that helps me be confident working with patients is I did have a ketamine experience myself where I did multiple sessions and I used it, very seriously. I'm a human. I have self-growth goals. And so I was able to design that and work with somebody to make sure I was maximizing the ketamine experience. And it was profound and it helped me make shifts that have allowed me to let go of some ways of being and some rules that I had in a very safe way. I also had a couple of difficult experiences that I'm very grateful for because not only were they metaphors for my, life in general, but also have allowed me to help other clients prepare and know what to watch out for, and then also navigate anything that comes up. So those are two kind of related things that I just wanted to say about kind of what's happening in the underground and the ethical, moral, therapeutic responsibility that I think we have as providers to be fully trained, fully aware, so that we are able to really hold that appropriate space and prepare and help our patients integrate as well.
Yeah, I would absolutely agree and echo everything that you said. I share um, sentiments equal to yours, and I would equally advocate, people educate themselves prior to journeying on some of the other substances. While there's a tremendous amount of benefit that lives in the other psychedelics, there should be some level of trepidation. There should be some level of assessment of risk, which is really all we can do. Judgment calls is how we function in life, and I would echo again the statements that you've made. Yeah, that was very accurate. And as far as having the experience of ketamine, yeah, definitively. Like I said a little earlier, I used to go through the trouble of trying to explain to patients what the experience may feel like, the paradoxical effects, and I really just scaled back on that entire conversation and just really stress on the fact that it's going to be beautiful and it's going to be safe and there's going to be a lot of introspective conversation and just to let things go and to kind of just be there and I'm in the room with them and allow them to do so, but until you've experienced ketamine in the clinical setting, you really can't explain it, and you really can't be there for the patient because you don't empathize with their process and how they're going through it. And likewise, when they give you feedback towards their experience, if you've already had ketamine, you have a deeper understanding as to what they're trying to convey, and you're able to make those adjustments for the following segments and the following sessions in order to accommodate their purpose and their needs. So yes, on both points, definitively agree with you.
That's great. And, I think that's something that we can empower patients to seek, the right care. That's something that we haven't seen before with any other, substance or prescription that, it's wise that your provider has had the experience too, so they really know. But I think we can empower patients to ask their providers around that and also challenge other providers in the space to make sure that they're approaching things ethically and kind of know the process as well.
Yeah, yeah, I would agree. I would agree. It's always a pleasure. We can probably stay on these types of calls for hours and hours, as this is something that can consume me entirely. I can talk about
Yeah.
psychedelics and ketamine, especially all day. Um, when it's a passion, it's more of a leisurely conversation. And that's the case with you. When we first met, we had to end abruptly because of commitments. But these are conversations that can go on and on. So I really appreciate you coming on and having this conversation and giving me the time to be able to discuss this with you again. It's always an absolute pleasure.
It's always a pleasure for me too. I love my job. I love helping people and I love to be efficient around that process. So it's been really nice to align with you and the work that you do. So thank you again for what you do for our patients, and we'll continue this conversation.
Hey, have a good one.
You too. Bye bye.